Thank you, everybody, for coming to the Awake and Thriving podcast. Today, we have with us Victor Briere. He is co-founder of the Pacific Coast Ayurveda and the IITVS. Welcome, Victor. Thanks for being with us.
Thank you for having me.
Yes, definitely. So I've always wanted to have an Ayurvedic doctor on the podcast. You guys are very elusive. I've been trying to get one of you guys on for a really long time. So I'm super happy to have you on. So I just wanted to start off with what is Ayurvedic?
The big question, what is Ayurveda or Ayurvedic medicine? So Ayurvedic medicine, I'll give you the very small nutshell version. Um, it started in India or ancient India. So what is now India? Uh, 5, 7, 10,000 plus years ago.
Mhm.
And it developed over time. It started as a plant-based medicine and of course evolved over the millennia and spread and transformed into Chinese medicine, or you could say Chinese medicine and Indian or Ayurvedic medicine had the same roots, root medicine. And then thousands of years later made its way over to the United States in the roughly the 60s, 1960s, and has been slowly becoming more popular in the United States until it's starting to become pretty popular now, actually. You go into Whole Foods or something like that, and you'll see Triphala on the shelves, which is an Ayurvedic herb, or people are very familiar with ashwagandha or turmeric, right? Turmeric's the big famous one. Um, Ayurvedic medicine is a holistic medicine. So, what does that mean? Because we hear that word, but what does it really mean? It means that you can't take a part of the body and just deal with that part of the body. The body is a whole, and every part of the body influences every other part of the body. So we treat someone as a whole being. And if there's something wrong with your liver, then there's probably something wrong everywhere. And that's not to raise alarm bells or anything like that. What it means is that we're an integrated system. We don't like separation and isolation of things. And then, okay, well, you have a liver issue, so we're just going to give you a pill for your liver and ignore everything else and hope it all works out. Ayurveda says, no, 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 let's find out what the root cause of a pathology is and then bring the entire body back into balance.
Okay. How long does that process usually take for certain people? The like bringing the body back into balance.
It can take anywhere from a day to years, to
Really?
be perfectly honest. Yeah, it depends on the severity of the imbalance. Some people have imbalances that are extremely chronic that started at birth or short or early into childhood that have sustained over many, many, many years. Other people have very mild imbalances, like, okay, let's take a super mild imbalance as an example. You overeat one night,
Mm.
right? Ayurveda would consider that a creation of a minor imbalance in your system. But if you just eat a very light breakfast the next day, drink some hot water, or fast until lunch, then you've healed your imbalance. So there's a huge range. And the whole art of Ayurveda is we all have a balance point, basically, that's defined by our individual constitution. And it's like a sphere, if we want to use a metaphor. And as long as you stay within that sphere of balance, you're okay. But when you start stepping outside that, you start developing illnesses. And the further you go outside that sphere and the longer you stay outside that sphere, the sicker you're going to get.
So I found with holistic medicine, unlike like Western medicine, people are used to Western medicine and they're used to the quick fix. With holistic, since you're starting with the whole body, usually like there's not instant gratification. So that's really hard for a lot of people to like realize that it's going to take a while sometimes to get your body back in balance. Do you find that you encounter that a lot as well?
Yeah, all the time. There are so many fears around holistic medicine and, frankly, misconceptions.
Yeah.
So, the one misconception, which isn't wholly inaccurate, but I would talk about it a different way, is that it's slower. It's not
Mm.
necessarily true. Ayurveda has some really powerful medicines that can act very quickly when necessary.
Mm,
and have major side effects, just like Western medicine does.
yeah.
It's more the attitude of approach. And the attitude of approach in Ayurveda is, okay, yeah, you have an imbalance. And yes, of course, we want to give you relief as fast as possible.
Yeah.
But there's a deeper thing being reflected by this symptom.
Mm,
And those deeper root causes, like I mentioned earlier, those typically take a lot longer to deal with. And you want it to, because while we want instant gratification in our mind,
mm,
our body takes time to rejuvenate, heal, repair. It's like you can't build a house in a day,
true.
or the cliche, Rome wasn't built in a day, right? So our body takes days, months, sometimes years to reverse pathologies, and we need to be patient with it. But if I have an acute, let's say, infection, right? There's Ayurvedic antibiotics. They're just herbal based instead of chemical extracts from herbs, right? Most medicines come from plants.
Interesting. I think I had a friend of mine. She actually continued to have UTIs, and she would get a UTI, take an antibiotic, but then I think it would mess up her stomach. And then she would end up getting a UTI. She was in this vicious cycle, and she ended up going the holistic route. And I want to say she integrated something like charcoal and olive leaf something extract. There was a combination that she figured out, and she finally made herself get out of that vicious cycle. And it was the holistic approach, because the antibiotics through Western medicine were really putting her in like a year-long bout of UTI, and then better, and then a UTI.
Yeah, exactly. I mean, Ayurveda is all about breaking the cycle of disease. So, we're used to it and we grew up with it, and it's like, oh, I'm sick, I go to the doctor.
Yeah.
But Ayurveda has a bit of a different idea about health, which is just because you're not sick doesn't necessarily mean you're creating health.
Mm.
That's a very different outlook. So we want to actively create our health. We want to make choices that bring vitality, as opposed to just have this thought. It's like, oh, I feel okay today, so I can do whatever. And if I get sick, I'll go take a pill and maybe that will help.
Mm.
We're getting sicker and sicker in our society. That method, that attitude, that outlook is not working, and we need to abandon it.
Definitely, definitely. That there's a big question for that one that we can dive into, but I want to start somewhere else.
Yeah,
But we're going
sure.
to get there. I can tell we're moving towards that direction.
Yeah.
So for an Ayurvedic doctor, there are programs in the US that you go to school for. You don't have to go to like India or anything like that, right?
No, you do not have to go to India, and there are some great Ayurvedic programs in the United States, and it's been a journey for Ayurvedic education in the West.
Mm.
There is a very famous Ayurvedic doctor, Dr. Vasant Lad. He started the whole show. He opened up the Ayurvedic Institute in Albuquerque, and really brought Ayurvedic education into vogue many, many years ago. And since then, more and more Ayurvedic schools are popping up, and it's turned in from like, a few 100-hour training just to do the basics, to now full on Ayurvedic doctor programs that span over 4 years.
Oh, wow.
Yeah.
Okay. Okay, that's interesting. And you guys are able to give herbal supplements, is that correct?
At a certain point in your training as an Ayurvedic practitioner, so you have an Ayurvedic counselor, that's the
Mm.
first level. Then the next level is Ayurvedic practitioner, which is more training. And then the third level is Ayurvedic doctor, which is a big quantum leap of training to get to that point. Um, Ayurvedic practitioners and Ayurvedic doctors can give herbal supplements. Ayurvedic counselors are mainly working with food and lifestyle.
Okay, perfect. And then, so this leads into the next question. So, if you're coming in for your first visit, like I have never been to an Ayurvedic doctor, what would I expect, and how often? I suppose how often I come to see you would depend on my specific needs, correct? Or how? Let's start off
Yeah.
like what would I expect my first visit with you?
Okay, so it is very need based. Ayurveda is going to be, what do you as an individual need? It's not about, okay, I need to produce 10 million pills that basically deal with a global problem. And, here, I'm going to close my eyes, give it to you, you take it, hopefully it works for you. Ayurveda takes the opposite approach. It's like, okay, there's this human being sitting down in front of me. And what do you need? Let's figure you out. So you would come in to the clinic, you would sit down. You would have given me your whole health history in forms, we're all used to that, right? So you tell me what, ancestral issues you've been having, whether your family has a history of diabetes, cardiac issues, cancer, whatnot.
Mhm.
Tell me what medications you're taking. You tell me what supplements you're taking, the whole everything. So, and then we start a conversation. Say, first off, why are you even here? Right? It's like, oh, I get migraines, just for example. Okay, how often? And we get really into detail about what that looks like for you. Where on your head is the pain? How often does it happen? Are you light sensitive? Are you sound sensitive? Is there nausea? Is there vomiting? How long do they last for? So the whole thing. And then we start digging into your lifestyle because that's where an Ayurvedic doctor or practitioner is going to come into play big time. They're going to know these lifestyle rules that might not seem so obvious as to why they're contributing to the creation of your migraines. So, and a lot of times people are like, okay, I know I should have been going to sleep at 10 p.m. every night. So I know, but I stay up till 1
Yeah.
every night. And by the way, I drink a cup of coffee at 11 o'clock at night. So, right. So we all go, ooh, right. But the reality is we all do stuff like that, just our version of it. And so it's like, okay, well, let's talk about that because it's easy to say, stop doing that. But that wouldn't be very Ayurvedic to approach to just say, stop it. Yes, you need to stop it, but there's a reason why you're doing that. There's a cause underneath that. And we need to get to that because that's buried in the lifestyle and it's important to the pathology. And we need to deal with that, not just the habit that's popping up because of something deeper.
Okay.
So, a lot of conversation around that. I think the average visit in a doctor's office is like between 6 and 10 minutes these days. My first visit with someone is minimum 45 minutes, minimum.
Oh, wow.
So, we got to understand what's going on inside your body.
Mhm.
And then we create a lifestyle protocol and dietary protocol or food protocol. I'm not a huge fan of the word diet, but food protocol that starts to alleviate the symptoms. But while alleviate the symptoms, you're also trying to balance out the entire system. They go hand in hand. So we talk and we get to a basic protocol in the first visit. We create an herbal formula for you that's custom to you. And then I'd probably want to check in with you about a week, typically. And then check in, see what's working, what's not, where the resistance is, where it's trouble, where it's challenging, where the application is hard or impossible sometimes. And then we figure that out. Then we check in maybe another 2 weeks, depending on if someone's doing really great, once every month, once every few months, and then just as needed when something pops up. If someone's very sick, like cancer or Parkinson's or something really severe, and it looks different. It's much more frequent, much more intense, more demanding, frankly. Just to be honest. And if someone's dealing with addiction, if someone's dealing with addiction, then I like to talk to them almost every day, even if it's just a brief check-in for accountability reasons, for connection reasons, especially during COVID. People, especially struggling from addiction, are suffering from insane amounts of connection deprivation, aka loneliness.
Yeah.
And that's going to create a pathology according to Ayurveda. There's no escaping it. If you're suffering from loneliness, you're going to get sick. It's just a matter of time.
Yeah, definitely.
Yeah.
Okay, and what are some of the biggest health issues that you find most common in these patients, in most of your patients? How about that?
The lifestyle diseases. Diabetes is skyrocketing right now. That is a huge one, or pre-diabetes, which Ayurvedically speaking would be called diabetes. Pre-diabetes means the pathology of diabetes has already begun. It just isn't at some number that's we're calling diabetes in allopathic medicine. So that pathology has already started and needs to be reversed because for obvious reasons.
Yeah.
Diabetes is huge. Second one is cardiac issues, heart disease. We've known that for a long time, right? That's been a common one. But why? Why cardiac issues? Well, of course, diet,
Yeah.
for sure. The American diet is pretty bad. Just the standard American diet.
Yeah.
And so even someone who thinks they're eating healthy is maybe just eating just okay,
Yeah.
because the standard's been pushed so far to the extreme of unhealthy that someone who's just in the middle looks like they're, a saint.
Yeah.
Um, and why is there? I mean, there are so many stress factors to cardiac issues, and
Mm.
not just like I'm overworked, but relational stress and self-image stress and existential stress, all those things. And
Mm.
then the third one, which I think needs to be really, really paid attention to right now, is loneliness. That
Mm.
is one of the main reasons people come to the clinic. And there's an interesting twist there. It's, I have a rash, whatever. I have a skin issue somewhere, right? And they can't get help. And it's like, I don't want to just put a cortisol cream on my arm every day. I don't want to take, or acid reflux. I don't want to take Nexium for the rest of my life, right? Well, they go and they're basically kind of been like, well, that's what we got for you, so move along.
Mm. Yeah.
And that triggers the feeling of abandonment and loneliness.
Mm.
Deep down inside, it's like, I can't get help for my basic needs. And then they go home, it's COVID, they can't go out, they can't talk to anyone, they can't see anyone,
Yeah.
and so they're reaching out for a deeper level of help, but deeper level of connection
Yeah.
in whatever context they need. So that's huge these days, huge.
Yeah, I think there's going to be a big recovery period from the whole last year, and even depending on right how this year goes. To be honest, there's a lot of people that live alone, and they, depending on where they were during quarantine, they couldn't see a lot of people.
Yeah.
So, and then the new immunizations are coming out, or the new vaccines, and I'm noticing that a lot of people are getting them, but they're still believing that they can't go out and see people, and they still have to keep their circles really small. So they're still quarantining themselves, which I'm already seeing them having issues. So them quarantining themselves even after having the vaccine is, honestly, that's wild to me. That's just blowing my mind on where we're going right now, this year. So, what do you think about that?
I think that we have to do everything we can to, one, make connection a priority.
Mhm.
And so that's one, because that's an internal thing. I mean, we were already before COVID, we were already becoming a lonelier and lonelier society.
Yeah,
There have been studies done on basically the amount of people that someone can say, I can really rely on this person.
yeah,
That number has been steadily dropping
yeah,
throughout the years
yeah.
and is now, in my opinion, dangerously low.
Mhm.
Um, and we need to understand that connection physiologically is a human necessity, not an option. And that goes into the vagus nerve, the autonomic nervous
Yes.
system. Yeah, the golden word, vagus nerve. And so should I talk about that just for a little bit? Give our
Yes.
list. Okay.
Yes. What is the vagus nerve? A lot of people will have never heard about this. I heard about it, I think, before. I don't know why. Maybe in Pilates class, but I've worked with this before. I've heard about this for sure. But I would obviously love to be educated a little bit more about this.
Yeah, it is a tragedy that we do not learn about the vagus nerve in the same way we learn about the heart, lung, and brains. I mean, even in elementary school, this is your heart, this is your brain. It's like this is your vagus nerve. It should be in the song, right? The vagus nerve is the longest nerve in the body. It
Mm.
is very unique in so many ways. It runs from your brain, all your sense organs, all of them, vocal cords, heart, lungs, diaphragm, stomach, small intestine, large intestine, spleen, pancreas, reproductive organs, liver, gallbladder. What did I forget? Right.
Yeah.
So it connects to all your internal organs, everything, and through your sense organs. That means your visual stimulation, auditory stimulation, what you taste, what you smell, what you touch, gets translated through your vagus nerve and then communicates to all your internal organs. So if I see something like a puppy that makes me happy,
Yeah.
I just stimulated my vagus nerve to say, hey, this body is safe. This environment's safe. We're all good. Begin digesting food. You can rest. You can relax. You can release stress. You can let your guard down. You can become vulnerable. You can connect. You can engage socially with the things around you. And we can rejuvenate. We can heal. The body is safe to heal. Versus if I see a dog that's baring its teeth and looks like it's going to come at me, my vagus nerve says threat, right? I see that, I hear that, maybe I even smell it, right? And my body says threat, 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 you're under attack. Engage a defense mechanism, either fight, run away, or basically freeze and hide and hope the dog goes away. And that's called the sympathetic nervous system. So that nervous system takes all my energy away from digestion, takes all my energy away from healing. It takes all my energy away from tissue repair, takes all my energy away from social engagement, and it moves that energy into immediate action, deal with the problem mode. So I run as fast as I can, and I jump over a fence. I get to the other side. The dog's running, barking, all that stuff, but it's on the other side of the fence, and I'm safe for the moment. And so what do? I take a big sigh of relief. The threat's over. So in a healthy body, my vagus nerve says, okay, body, liver, spleen, pancreas, stomach, intestines, begin operating normally again. Heart rate, you can drop. Lungs, diaphragm, you can expand. Lungs, you're good. And I can go on my merry way. That's in a healthy person. But when you're, and that's an extreme example, the reality for most people is that day after day after day after day, we pick up on these threats in our environment, or our environment is very threatening for real. And we spend too much time in our sympathetic nervous system, more than our body is capable of keeping up with. Because when I'm in my sympathetic nervous system, I'm not healing. It's not happening.
Yeah.
Or it's happening to an extremely suppressed degree. And so I stop sleeping well. I can't digest my food well. I can't even engage socially well, because once you start perceiving your environment as threatening, the world looks threatening. So a stranger comes up and they look neutral. If I'm already threatened, I'll interpret that as a threatening look. And these are all happening in the background, in the subconscious and unconscious. It's called the autonomic nervous system because we don't have direct control over it. We have indirect control over it, meaning like breathing techniques, things like that, or looking into the eyes of a loved one can help make you transition from sympathetic to parasympathetic. But I can't just sit there and say, I'm happy, I'm good, and now all of a sudden I'm happy, I'm good. That's not how it works. So there's this complex underworld of nervous system networking going on in us 24/7.
Is that something that's similar to adrenal fatigue that people get? Because I find that what you described really correlates. And for me, it correlated a lot being in Western medicine. It was stress, though. It was like stress being in that work environment. So that would be, is that similar to adrenal fatigue, or what do you think about that?
It is certainly a part of, or I'd say adrenal fatigue is a part of that whole cycle. So adrenal fatigue is big on the HPA axis. A lot of people have heard about the HPA axis. So it's basically part of your brain, the hypothalamus, adrenal gland, and pituitary, HPA, hypothalamus, pituitary, adrenal axis. That is a classic cycle in your body for stress. So your pituitary signals, your hypothalamus perceives threat, your pituitary signals your adrenals to release cortisol, cortisone, cortisol. Sorry, cortisone's the cream. Cortisol's the hormone.
Mm.
So that circulates through your system, and it's called the stress hormone because it's part of creating that physiological reaction in your body to engage a defense mechanism. But the vagus nerve is the nerve that takes the sensory input and communicates to your internal organs. So
Mm.
that information runs through your vagus nerve, and your vagus nerve says to your heart, lungs, all that stuff, change, change, go into a defense posture. That's what stress is. Stress is going from a receptive, rejuvenative, social outlook or attitude or stance or whatever you want to call it to a defensive one.
Mm.
We're only built to be defensive for short periods of time when we're handling a real threat. That's all our body's made to handle, and it's pretty good at it. But we start engaging in all this perceived threat because that's all it takes is the perception of threat. The threat doesn't actually need to be there. And then that's where, if I was abused when I was younger, let's say, and I carry a wound, that's might be how we talk about it. Or, I wouldn't say this, but maybe we carry a trauma. I think we need to be careful with that word, but we
Mm.
carry a trauma into our adult lives. Maybe just the look on someone's face when they're not even thinking about us, right? All of a sudden sends us into our sympathetic nervous system. And it's like, whoa, that's stress, the tension, the tightness, the defensiveness, the contraction, the readiness to escape, to separate. That's stress.
Hmm, interesting. Okay, so
Yeah.
the vagus nerve, the way I'm visualizing it is it's like the highway, right? It's like one of the main highways, and say
Right.
like the hormones and everything are like the little cars communicating on it, right? Or
Kind of.
how would you describe that?
Hormones can circulate through the blood, not necessarily the nerves, things like that. I would say it's an information highway. And the vagus nerve is unique because it's a two-way highway. Many nerves are one way. They go from the brain to somewhere else, or they go from somewhere else to the brain, or somewhere else to somewhere else, right? So those are one-way streets. The vagus nerve is a two-way street, meaning from the brain to all the other organs, from the organs to the brain. So let's say here's a good example. Gut brain axis. That's a popular term these days.
Mhm.
That's all through the vagus nerve. I eat something that gives me indigestion. Let's say it's 8 o'clock at night. I eat a huge, heavy dinner. I get indigestion because that's not the time at night you want to eat a huge, heavy dinner. Now, my stomach is under stress, and my small intestine, my duodenum, which is where the stomach becomes the small intestine, that little C-shaped organ, and it's working too hard. My liver's working too hard, so it's communicating via the vagus nerve, stress, 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 stress. The body's in trouble here. It's got too much to handle. That can send a message up to my brain, and if I'm not paying attention to myself, and maybe that's just what I normally do, I interpret that stress as I'll just label something in my environment as anxiety creating. Happens all the time, right? Oh my God, you left the, the faucet on again, right? It's not the faucet. It's the anxiety created from the food I just ate. But until I become conscious of that, I don't know what to put it on. And my mind is going to pin it on something, whether it's a person or a thing, or maybe myself. All of a sudden I'm sitting there, I'm just such a bad person. Ah, I did terribly today at work. God, I'm a horrible parent. Jeez, what was I thinking? But it's not. It's just that you have indigestion.
That's interesting.
Yeah.
Okay. And what could somebody do? This is going to sound crazy for me to say, but what can you do to strengthen or become more cognizant of that? Is there anything you can do to improve the vagus nerve or to help with that?
Thousands of things you can do.
Really?
And yeah, and Ayurveda has been doing these things for a long time. And not just Ayurveda, you'll see that most holistic Eastern, I guess I'll say, healing systems or healing systems that originated in the East, let's say yoga, right?
Mhm.
They are constantly working the vagus nerve to create what's called nowadays, Dr. Porges. He did a lot of work around this. He's a great person to look up. He created or discovered the polyvagal theory, or however you want to say it. It's called vagal tone.
Vagal tone.
And remember, the sympathetic nervous system is not bad. We need it. It's good. The parasympathetic system is good, but you can have parasympathetic nervous system disorders as well, but we don't have time to talk about that right now. Neither system's good nor bad. It's just, is it happening at appropriate times? Your ability to transition from the sympathetic nervous system into the parasympathetic nervous system is the strength of your vagus nerve. That's your vagal tone. That's happening all day long. All day long. You're switching back and forth. So you want to create that. And when you create the ability to transition smoothly, we would say that that person's resilient, or that they can handle a lot of stress, because they'll go into a high pressure situation, and maybe they will get stressed out, but shortly after, they're actually able to return to a state of calm, not fake calm. We like to pretend we're calm when we're not. That's suppression. I'm talking about genuine physiological calm.
Okay.
So not just, I can grin and bear it for a really long time, like years.
Yeah.
I'm talking about, no, I got stressed. The stress period's over. I do maybe a breathing exercise, multiple breathing exercises. Maybe I chant mantra. That's a yogic technique, or many traditions have that technique. Or I engage socially and play and have fun.
Yeah.
And I actually return to a state of physiological calm. The better I can do that, the more resilient I can be. There are yoga postures, there's breath exercises. Keeping your digestion in good health is essential, absolutely essential in that process. Having healthy relationships, essential in that process. So loneliness, if you're isolated or lonely, you're going to have trouble switching from your sympathetic nervous system into your parasympathetic nervous system. That means your body will not heal well.
That's terrible, especially right now with everything we've been going through.
Yeah.
It's really sad to hear that there's going to be a lot of people that are in that right now. So,
They're in that, but if they're listening to this, if they're one of those people who's listening to this, then it's really, it'd be the healthiest thing you could do for yourself is to reach out and start connecting to healthy people, basically. And I know that's a big, very, very, what counts as healthy, right?
yeah,
But we could do another episode on that if you want later. What
definitely.
counts
That's a
as healthy?
whole nother segment.
Yeah, exactly. Yeah,
But, and then I know we talked about before, did you write a book about pulse diagnosis?
I did. I wrote a book called Pulse Unveiled: The Art and Science of Ayurvedic Pulse Reading.
Yes. What
And
is all that about?
yeah, pulse reading is amazing diagnostic technique in Ayurveda and Chinese medicine, and Unani, which is not as known as Ayurveda or Chinese medicine, but it's a Middle Eastern form of medicine that is very similar to Ayurveda and Chinese medicine. And they also have a pulse reading practice. So, pulse reading, Ayurvedic pulse reading. I can speak for Ayurvedic pulse reading.
What was the one that you said it wasn't? What was the name of that other?
Unani. And I hope I'm pronouncing it correctly. So please forgive me if I'm not.
Okay.
Yeah.
All right.
Yeah.
And then okay, so let's learn a little bit about pulse diagnosis. I would love to hear a little bit more about that.
Okay. So you go to a doctor's office, just allopathic Western doctor. They take your pulse and maybe they'll actually use a monitor or something like that. And you get a heart rate, and it's how many beats per minute. That's what we think of as pulse, right? Okay. Ayurvedic pulse reading is saying, great, we can get the heart rate, no problem. But we're also going to learn everything else that's going on in your body via your pulse. The whole idea of pulse reading is that via the pulse, all your internal organs and the doshas, Ayurveda, Vata, Pitta, Kapha, that's what you're going to hear about. If you type in Ayurveda on Google, you're going to see Vata, Pitta, Kapha. Take a quiz. Don't take the quiz, or take it for fun, but take it with a grain of salt. It's going to measure how you're functioning, all your systems, all that stuff. All that can be read through the pulse because everything in your body is communicating with everything else. So when we're reading pulses Ayurvedically, we take these three fingers, index, middle, and ring finger, and we place them on the radial artery. And I don't know if you could see that, but the radial artery is below the radial tubercle, which is this bony notch right here. And you place the index finger there, and there's an artery there. And
Mm.
that's where most pulse readers will read the pulse. And there are pulses all over your body. That's just a very convenient place to read the pulse.
Okay.
So we place our fingers there and we focus. We close our eyes. We enter into a very deep parasympathetic state and we relax. And we encourage the person whose pulses are being read to relax. And that forms a yoga of awareness, where the person who's getting their pulse read, their attention is united with my attention on this pulse reading or this healing process.
Mm.
And start measuring. We start listening, feeling and listening.
Mm.
So the pulse starts expressing itself. Sure, of course, beats per minute, but how warm to the touch is the skin? How variable is the heart rate? Heart rate variability is a sign of health, um, to a degree. And how slow, how fast, how sluggish. And now we get into the qualities. What does the pulse feel like on the actual fingertip? Is it pricking like a pin? Is it tapping lightly on the finger? Is it broad, rolling over the finger like a wave? I mean, there are so many ways. And now we look at where that quality is making contact on 5 different points of each fingertip, on each of the 3 fingers. And then we do that on seven different layers of the pulse. So that radial artery, we compartmentalize in 7 different layers. So the hands moving microscopically and
Mm.
measuring. And then we check the status of each of your individual organs through the pulse and how they're expressing. And by receiving all this information and then synthesizing it intuitively, and I know I'm using that word on purpose because that's a whole topic in and of itself. We actually start to put the pieces together of what the pathology is inside this person, what's going on. So, yeah, maybe they're coming in because they're having heart palpitations, but really it's a digestive issue. But it's like, hey, I don't have a stomach ache. It's like, well, okay, but I can tell that this problem's stemming from your stomach or your whatever. That's just an example. It lets the Ayurvedic doctor peer deeply into the person's body and address a root cause that may not be known to the person who's come in for help. Not because they're resistant, but because how are they going to know? Right? So it's a beautiful art. It's a beautiful practice. It takes years to refine and mature and all that stuff, but it's so good for the practitioner too, because it's so focusing and it's so um, tranquility bringing. And I mean, it's a meditation basically.
Interesting. And when somebody sees you, so you'll do the pulse on them. Do you do any kind of blood work or do you do anything like that with them?
I'll review their blood work. I myself do not rely on blood work, but if they have it, I'll review it.
Okay.
Um, and we look at the tongue as well. That's also common. So we got to remember that blood work is a relatively modern creation. It's
Yeah.
great,
Yeah. It is.
but people have been healing from severe illnesses for thousands of years. We like to think that lifespans were so much shorter thousands of years. That's not really true. I mean, we heard that once somewhere along the line, and we're like, oh yeah, it must have been the truth, but it's not really true. I mean, in the ancient Ayurvedic texts, they talk about the average human lifespan being close to 100 years.
Mm.
So I'm not saying everywhere in the world that was happening, but in cultures that had a rich holistic healing system, they were dealing with cancer, they were dealing with severe cases of diabetes, they were performing surgeries successfully,
Wow.
brain surgery. Not so this concept that these days we have all these technologies and that nothing like that existed in the past is just not true.
So
Uh,
the
yeah,
surgeries, I've heard of that before, and I think I may have read stuff like that, but that blows my mind that they were doing surgeries hundreds of years ago. Like,
thousands.
Yeah.
years ago. Yeah.
How? How?
Yeah, successfully, very successfully. So of course it's come a long way. I'm not trying to say that. There are all these things and but there are also new diseases. So we like to look at, oh hey, we cured this disease, but we also created about 7 or 8 new diseases with our lifestyle choices.
Mhm.
So Ayurveda is always going to come back to that. It's going to say, yeah, we can perform surgery, but let's stop this problem way before you need surgery.
Yeah,
And of
definitely.
course, there are accidents, there are things that are unavoidable, but a lot of them are avoidable. The
Mhm.
bulk of them,
A ton of them are.
a ton of them.
You said something that I thought was really interesting because I spoke to an acupuncturist who was like Chinese medicine doctor as well, something to the likes of that. But he was really informative. But he spoke about the tongue as well. And I remember in the beginning you told me you guys kind of maybe came from the same root
Yes.
and Ayurveda and Chinese medicine. So I'd love to hear what you say about the tongue because what he said I was kind of blown away by that a little bit.
The tongue is in a lot of ways similar to the pulses. If someone knows what to look for, they can see the entire body in the tongue. And it's a specific type of training. And Chinese medicine, they focus on it and they get in deep with it. There is Ayurvedic tongue diagnosis because of the common roots.
Yeah.
And some Ayurvedic doctors specialize in that. Some Ayurvedic doctors specialize in reading lines on the face, facial features. And because the whole body expresses itself through the face, the eyes, things like that. But more often than not, if you have a mature practitioner, they're never going to rely on just one thing. They're going to cross reference all the time. So my inclination is to go to the pulse, but I'm also going to look at your tongue. I'm also going to look into your eyes. I'm going to look at your face. I'm going to look at how you sit in the chair. I'm going to listen to how you talk. Those are all those are all giving me information as to what's going on inside your body that we can't see.
Okay. He said that you couldn't scrape your tongue for a few days because that coating was important, which I thought was kind of gross because I think a lot of people scrape their tongue, right?
Yes.
Like
Yeah. A lot of people scrape their tongue. That coating, if it's too excessive, is a sign of incomplete digestion of food, which then it's called ama in Ayurveda, AMA. And if ama circulates through your body, it starts to impede the function of anything. So it's the source of a lot of diseases. And, classic example is arthritis. Alma gets lodged in the joints, and we're talking about microscopic. I'm not talking about like chunks of broccoli in your joints, microscopic. But and then it's like, well, I don't get it. How can eating better cure my arthritis? It's like, well, that's why. When you digest your food properly, you stop creating alma. It stops getting lodged in your joints, where your immune system then acts on it and creates inflammation. And then your body starts repairing the tissue. It's all going to come back to digestion at some point.
because your body wants to heal. That's what I've heard before. Like your body wants to heal. Just things get blocked up. We don't treat our body properly and we just can't heal.
Your body is always striving for equilibrium and homeostasis according to your own unique constitution. So that's another huge thing in Ayurveda is everyone has a unique constitution and you should not try and match someone else's because that will make you sick. Whereas for them, it's healthy. So that gets into the whole body image world, right?
Mhm.
You get men and women suffering from body image issues where they have a naturally healthier. It's healthy for them to be denser, have denser tissue, heavier bone structure, all that stuff, but they want to look like a runway model,
Yeah.
right? If their body were to look like that runway models, they would get so sick, it's unbelievable.
Yeah.
They're supposed to have, and now, of course, you got to seek out professional guidance to know whether you're in that range. But it creates a lot of problems. We don't, as a culture, we don't honor that there are these different constitutions and that each of them have a beauty to them.
Yeah, I agree with that. I know when I was younger, I was just thin, painfully thin, like 20 pounds lighter than I am right now. And I remember I always wanted to look like Beyonce. And I realized 15 years later, I was like, I'm never going to look like Beyonce. I'm never going to have that shape. I'm always going to be like just me. But I've learned to appreciate that. It took me a long time. But I think I would hope most women get to that point sooner than I do, but I don't know.
Yeah, and men, right? They want to look like LeBron James or whatever it is,
Yeah,
right? But we can't let this image of what we desire based on basically in a nutshell fears
yeah,
around if we're going to be accepted. That goes back to the loneliness thing.
yeah.
Um, determine what our prakruti, that's the word for it in Ayurveda, our basic constitution
Mhm.
that we receive at, or I guess you could say receive, that we are created with at birth that never changes throughout our life. That's our home base, and our health is going to be determined on how closely we can stay to that prakruti throughout our life.
Interesting. And is that what did you say before? Peta no or doshas? Or is that
So
what our doshas are?
doshas are functional, biological, functional aspects of our being, and they exist in all of nature. So they create our bodies in different proportions and they act in certain ways. They're also in the blade of grass that's right outside my window.
Hmm.
They're in every animal, every creature, every cell of our body. The doshas are acting. And yes, the intelligence of the doshas creates our unique constitution. So we have a different distribution of doshas in our bodies depending on who we are. And it's like a fingerprint. It's completely unique to each of us,
Hmm.
although there are common themes.
Okay, let's see. So we were talking about this, and I knew this was going to be interesting, but what, why do you think? I think we touched on this a little bit. We've been dancing around it a little bit. Why do you think our society is getting more sick with all the advancements of medical technology?
I think because the advancements in medical technology are fantastic at dealing with symptoms and terrible at dealing with the root cause of
Mm,
illness. Ayurveda has a beautiful, I mean, it's beautiful definition of health. And basically, it's someone's healthy if they have balanced doshas, they have balanced tissues, bodily tissues, and so on and so forth, balanced organs, all that, all the stuff you'd normally think of. And they are free from suffering in their mind.
mm.
That's the part that our culture is not good at.
No, no.
Not good at. We do not do the things because we say, oh, your mind's over here and your body's over here. Please erase that idea of the being from your mind because the mind and body are a completely integrated system. So anything I think affects my physiology, and anything my physiology does affects how I think.
Yeah.
Period. End of story. And so when I say, and I mean it very literally, when someone comes in and says I'm lonely, to me that is a health crisis. And our culture is barely beginning to acknowledge that. I mean, barely. And what's the answer? Antidepressants, anti-anxiety pills.
Mhm.
I'm sorry, but that's going to make the problem worse. It's like putting a band-aid on an infected wound.
Yeah. Yeah.
You can't do that because you're not dealing with the root cause. The loneliness is there. There's a reason that they're lonely. Why? That's going to be specific to each person. And until that's healed, that body is not going to be a healthy body, according to Ayurveda.
Yeah. I feel like Western medicine is really good at putting band-aids on
Band-aid.
symptoms. Yeah, they'll band-aid up everything, but they're not dealing with the real reason why people got to the spot that they're in now, unfortunately.
Right. Or diet, right? Diet as a root cause. So, and I don't want this to turn into, oh, I'm against Western medicine. I am not at all against Western medicine. It is really wonderful and beautiful for specific things. But I can't ignore the reality on the ground that when you go to a hospital and you're, let's say, a cardiac patient, or I recently had a client who had to go to the hospital because of an emergency. Um, he has severe digestive issues. And they're offering him jello and coffee,
Yeah.
you know? And I'm like, I'm sorry. That's just, you can't do that. You can't do that. And I get there are all these reasons for it and all that stuff, but that's what I mean when I say it doesn't matter how good the MRI is. If you give someone with severe digestive issues jello and coffee for lunch, they're not going to heal.
No, not at all. And then the correlation of the body and the mind, I find like I've noticed that for years now. But especially when I was working in really stressful environments, I would notice that if I'm stressed here, I wasn't eating properly. I wasn't sleeping properly. Like my body was getting affected profoundly by my mind not being right. And I'm hoping people are coming to that realization now that they do connect and you have to take care of both in order to really have a wholesome, healthy life. But in this day and age right now, I'm not sure. I mean, we're not there yet. Yeah, we're not there yet for sure. I know a lot of other countries. I think like there's some Asian countries, like I want to say Korea, that are not really open to mental health. There's countries that are not even accepting of that right now. Even though we're at the very beginning, they don't even acknowledge it. And then I believe they have like a high suicide rate because of that. So,
Yeah. Yeah. And I mean, that is a massive, massive world to jump into and extremely important. And, but I guess what I'm trying to say is that in our society, there's a fear around adopting these holistic lines of health because of like some of the things you said earlier. Oh, it's not going to be effective enough, or it's not going to act fast enough.
mhm,
No, or I'm just plain and simple. I'm used to it. I'm used to when I get sick, I go to a doctor. I'm used to that. That's comfortable for me.
yeah,
So to try something new can be scary, especially when it's something about something I'm already insecure about, which is my health.
yeah,
But we got to break through that barrier because these traditions, these ancient and modern healing traditions, I don't want to just label them as ancient because that gives like it's older, it's outdated. That's not true. It's ancient and it exists in the modern day. There's a reason for that
yeah,
because they have these techniques that go deep that say, okay, like we have to deal with some of these underlying causes,
mm,
whether that's or here, take this. The lonelier I am, the more I'm going to eat. The more food I eat, I'm going to eat what? I'm going to eat comfort food,
mm,
right? Comfort food is typically not the healthiest food in the world, especially when eaten for comfort reasons. So now I develop a digestive problem, but maybe I have a resilient upper GI. So I don't feel it, right? And so then that goes on for a long time and I start developing neurological problems.
mm.
But it started as a digestive problem. That started as an emotional issue. That started as a relational issue. That's the root cause.
Yeah, definitely.
Yeah.
Hmm. Wow. I feel I knew it. I knew this time would go by quickly just from our initial conversation. I'm gonna re-listen to this, and I'm glad everybody else will be able to re-listen to it because I feel like we went over a lot of like absolutely wonderful stuff. There's actually still some questions I want to ask you, which I don't know. Maybe we'll do a second one because there are a few questions that I would love to dive in and discuss it with you a little bit more. And I'll probably discuss it a little bit after we stop recording, and hopefully we can set up another time to do another session. Are you up for that?
Oh, yeah, definitely.
All right, perfect. So thanks for being on right now. I really appreciate it. It's been wonderful. You've been, I mean, like I told you, you've been like the unicorn I've been looking for. So I'm